Hey guys, I'm back again. I just uploaded the video that I just made about my college update, and this video is going to be about, as I said in the last previous video, about how's my CNA going, the program, how it's going. Well, so aside from the test, we have been like doing all these skills like and we practiced on a mannequin. We practiced on ourselves and the students. Uh, so far we just did how to ambulate a patient to a wheelchair, ambulate a patient to walk, um, and and then how to do positioning a patient to the side. Uh, to take blood pressures, um, how to find a carotid pulse, and even though my school didn't require us to get a blood pressure blood I can't talk, sorry, blood pressure instrument, I bought myself one so I could practice at home, and it's inside this bag, and then I have my stethoscope. Ta-da! See, I can listen to your heart. Looks like that. And then inside here is the cuff, the blood pressure cuff, and the bulb. So so far I practiced with my brother and my younger brother, and I believe I'm starting to get good at it. And to even get more better, I'm going to practice some more with my other relatives and maybe a friend that comes by to my house and, hey, let me take your blood pressure, even though it may feel weird for them. I'll still do it. But and then we did that's a part of a vital sign. We also learned how to do perineal care for women and men. So we practiced that in the classroom with a mannequin with the beds and stuff. And then also um, when we do our state boards, we will be using this. We will have to follow what's in this book, which has all the skills in them with instructions step by step. And let me tell you one. Okay, what I've done today. So today during class we learned how to provide fingernail care on one hand. So basically it says explains the procedure, speaking clearly, slowly and directly, maintaining face-to-face contact within whenever possible. So you tell the patient what you're about to do, and then um, you immerse their fingernails. But let's do something that's more really good. Sorry, because usually most of the skills they require you to do privacy with the curtain. Let me find one. So okay, this one which we did last week. Giving a modified bed bath face in one arm, hand and underarm. So basically the first step is always explain the procedure, speaking clearly, slowly and directly, maintaining face-to-face contact whenever possible. And then after you introduce yourself, you tell the patient what you're about to do. You close the curtain for privacy. And then you remove the gown while keeping the client covered. So basically, um, the cover, the patient is gonna have a gown, but you're gonna put something on top of that. So you could cover, it will be double covered, the patient, but once you lift up the underneath of the clothing, you will still have another layer that could hide their body parts. And then before washing, check the water temperature. I do that first. I get the basin and then pour water. I test the temperature. Ooh, okay. And then for the safety of the resident or the patient, I let him touch the water. He tests out the water if it's a proper temperature for her or her skin. And then I put on my gloves. I think I could put on gloves before touching the water because I don't know why they put it there, but I just would rather put the gloves ahead of time. And then you begin with the eyes, washes the eyes with the wet washcloth with no soap. Don't put soap on the face. Using a different area of the washcloth for each eye, and then washing inner aspect of outer aspect, then proceeds to wash the face. Basically, wash it again with clean water with the towel. You dry the face with a different towel that is dry and clean. Exposes one arm and then places towel underneath the arm. So you place a towel underneath so you could protect the linen underneath to be dry. So the bed could be dry. Apply soap to wet washcloth. This is the only part you apply soap to when you are wiping the person's arm and armpit. Okay, washes arm, hand, and underarm, keeping rest of the body covered. Rinses and dries arm, hand, and underarm. Moves body gently and naturally, avoiding force and overextension of the limbs and joints. Puts a clean gown on client. So basically, you're gonna put on a new gown, while the layer that was on top that you put earlier is now in the bottom, and then now you're gonna put the one on the top. You empty the basin, you rinse and you dry the basin, you use, and then you put it in the proper place, designated dirty area since it was already used. Avoid contact with candidate, which is the patient or resident clothing, and use linen with what you already contaminated with that you use, like the towels and the basin. After placing the basin, you remove the gloves properly, so underhand, and then you pick up and then all that, and then you put it into the waste container and you wash your hands, and then you give the signal light or device to the patient within reach. Then that's the end of the procedure. So that's one of the examples of what we've done you to give a modified bed bath. And so far the test, I'm getting better at it, but today I didn't do good. I scored below 19. So I will have to make that test up, because the good part about this class is that we get to make up a test that is really low, because we have to have a certain percentage before we can be able to participate in the clinical rotations. So I will be reviewing that chapter that we had a test on, but I didn't do so well, and I thought I did. It was just a lot of numbers that I had to memorize, and this was about regarding the vital signs. It was about the blood pressure, the auxiliary, the basically all the things that you do for vital signs, like weight and height. Basically, the test we took today, most of them talked about abnormal, like what is abnormal, what is an example of an abnormal finding of a blood pressure. So basically, whatever's out of the range of a normal of a blood pressure. Like I didn't study that. Like, well, now I know what to study, so I could retake it. I have to retake that because I really want to do good, and I just I want to get a good grade overall for this program. And then I have been keeping up with my workbooks. And oh yeah, we did our CPR last week. So we basically it was $30, and then we practiced on a mannequin, on an adult and an infant. So we were practicing. That was the whole entire 4 hours of class. So and then we had to take a test, but technically everyone passed because we just did the test as a class. So like verbally, so we all passed. So I should be getting my CPR card this Friday. And as I said before in one of my videos about my CNA journey, um, that you do need to have your CPR license before you enter the clinical rotations. So you need to have that. If you don't have it, you may be kicked out of the program just because of you don't have that. So I think a couple of people were absent or some people missed it. And I hope they had their CPR licenses with already prior to entering the clinical rotations. And also regarding about the test and the exams, if you do not have a certain overall percentage by the before the end of the midterm or after, the instructor can drop you. And because technically after the midterm is already, we go into our clinical rotations. So that's why I really need to do really good in the next couple of tests, which is I believe five, five more or six, and that's still a lot. Like, it's crazy. Like, it's a lot of material, but like this program is like really fast. So technically, sometimes I can't even keep up, and I just read the textbook, but and then I do our study guides. Thank God I do my study guides because it does help. But sometimes it doesn't help because the small things is mostly on the textbook, and the teacher does require us to read the textbook periodically before the test. So and these chapters are long, and we cover like four chapters four chapters each class or something, and then we get tested. It's not, it's ridiculous. It's just a lot, but you know what? It's training me to be a good nurse, and it's just training me because I know if I do apply for nursing school, which I will be hopefully before I get done with my prereqs. It will be stressful too, so might as well train myself. And I believe that's what the instructors are doing to us, is that they're training us for the LVN and RN programs because they are really rigorous, and they are basically preparing us for that. Because if we are not mature enough and we do not take responsibility for our own learning, then we will not make it in the nursing field, you know? And sorry, in the nursing field. So I like the experience so far, but it's really tiring. But I know there's nothing that is free, and of course you're gonna get tired to anything that you do in life. So, and plus I believe that failure is not an option. Okay, so that's about it for now. We just talked about we just had lectures, and we have been starting like our skills, like I mentioned earlier. We like today we did how to do denture care, how to clean dentures of the residents and patients, to do oral care, how to do cuticle care like fingernails and stuff. and oh yeah, that the thing that really interested me about the cuticle care is that you cannot use a nail clipper on someone's feet that is diabetic. That's a no-no. They don't allow you to do that. So it's really important to check the nursing care plan if they do have diabetes before caring for their foot care, their fingernail care, or those kind of stuff. It was really interesting. And then yeah, we did. Let me see what else can I talk about. Because I know it's been a long time that I made a video about this, and it's just a lot of information was being thrown at me. And sorry if I haven't been making videos. It's just I'm really busy, and I'm sorry, you guys. But I tried. I was my goal was to make a video every week, at least once a week. But it's not happening because a lot of things are being thrown at me, and of course I have to prioritize, and I have to do that first. So you guys don't understand that because you guys were nurses, you guys were nursing student, you guys understand that. So hang in there, and hopefully, if you guys have any questions, just ask because it's the right time to ask. Because I rather answer questions um that are more um smaller, because when I do talk, I sometimes don't even know what to say. Like I'm all over the place, and it's just yeah. Well, that's about it. So basically, the most important thing is that we started doing skills in the classroom, like what we will be doing during our clinical rotations, and then about the test. I just have to retake that one test that I did poorly on, and then that's about it. I should do another update soon too, because I need to keep documenting what I have been doing. Well, that's about it. I'm going to go to sleep now because I'm like really tired. And that's about it. Well, thanks for tuning in, you guys. Okay. And oh yeah, for those people that are in school, if it's your midterm, your exams, good luck, you guys. Study hard. Studying hard pays off, and just do your best as you can. And that's about it. Well, I hope to hear from you guys, and I'll talk to you guys soon. Okay, bye.